I'm pleased to have Tim Fischer, president of Jackson&Coker, with me here today to have a conversation about the industry. Tim, I'm so glad you could talk with me.
Thanks, Carey. Glad to be here.
Yeah. Well, you and I have talked a number of times before this conversation today, and we always have just some really good conversations about the future, retrospective. So, wanted to capture that. Um, let's get started.
Sure.
Let's just start with something easy. Like, how's it been going? It's been a great year. I think for a lot of organizations, it's been a tough year for others. How's it been going at Jackson&Coker?
Well, I always love talking to you because you and your members, obviously you're representing your members, so you have a lens looking at all 50 states and different organizations and for-profit and not-for-profit. And we do on the locum side as well. So as you know, it's been a challenging year in some ways, but it's also been very rewarding in other ways. So it really, and I think most years are kind of like that. I mean, the industry that we're in is one where, in theory, if there were 100,000 more physicians in the U.S. and the physicians were fighting for the roles that all of your member organizations had, we probably would be out of business on the locum side. So now we know that's not the case, and obviously there's a shortage of physicians and quality physicians specifically. So it's been a interesting year, but we've had significant growth. So we're happy that we can help out.
So you're staying busy.
We are staying busy, as I'm sure your members are.
We've seen that, right? So we've seen it in our benchmarking data. We've heard it from our members. Whether locums is the first solution or the second solution, it really has become a must solution for a lot of organizations. Yeah, we've certainly seen that growth. Well, so how does a company with that sort of growth and that sort of activity over the last year, how do you guys innovate? How do you stay efficient? How do you stay smart in this?
Well, it's an ongoing challenge, and I think we all continue to try to do that better. So I wish I had all the answers, but I don't. But I think it all starts with listening. And I talk to our team all the time about we have to listen on what our clients, which are your member organizations, and the members that you lead. We need to listen and find out what they're looking for. What are their challenges? What are their opportunities? How can we partner with them instead of just being a transaction where we find a physician or advanced practitioner and we match them up with a shift. I mean, we need to be doing more than just transactions, and it all starts with listening to what our clients want. I know that sounds simple,
Right.
and it's not, but that's really what it all goes back to. So when we want to innovate and we want to become more efficient, we have to know what the end result that we're trying to do is first. And that's really determined by what the clients need.
Yeah. Yeah, we've talked a lot about that too, especially over this past year. I was just reading a draft of a white paper that AAPPR is drafting because you and our other strategic and signature partners were at our strategic partners summit back in September. And one of the things major topic at that event was how can, and I'm going to say sides, right? How can these sides work together? And as I'm reading that paper, one of the things that really came out of that event was we need to stop talking about sides. People have different skills and they're bringing different resources, and they're addressing capacity issues during this shortage and just the difficulty in finding physicians, especially in the specialty areas. So we have to stop looking at it as, us versus them. And I think listening is really important. So I'm glad you brought that up. But it's not always easy, right? Because if it was just listening, then I think we all would have kind of check that off the box, check that off the list by now. What do you think why is it so hard? Why do we struggle with listening and developing these partnerships where we're working together, and why do some of them go adversarial? Like I'm going to pause there and let you speak.
No, I mean, you and I have had this conversation before, and I think it starts with listening, and that should be common sense, but unfortunately, a lot of times we don't listen to each other. I mean, just in the world today, I think it's a problem. So it's not specific to our industry; it's specific. I mean, just look around the world, pick up, go online, and I think listening is a problem.
Yeah.
And then, of course, you have to do it. I mean, you have to listen to we have to listen to what our clients want, and then we have to innovate, become more efficient, and do what they're asking us to do. But I do feel like the partnerships, you ask how the year has been, where we have been successful and where we're seeing significant opportunities is where we're partnering with our clients the best, and it's not adversarial or it's not transactional. It's where our clients are telling us, hey, we need somebody who can help us with reporting, or we need somebody who can help us with taking our schedule and taking our internal staff and our float pools, and not only looking at locums, but give us a solution for our entire schedule and workforce, specific to physicians and advanced practitioners. That's where we're providing value, and that's where partner sometimes is an overused term, in my opinion. But true partnerships are built on relationships, listening back and forth on both sides, and trust. And trust is something that you don't just give people; you have to earn it, and we know that, and we're trying to do that here at Jackson&Coker. So that is something that I think is fundamental to any future between your members and locums firms, is all of those things we just talked about. But it all starts with not being adversarial and saying, how can we work better together to help our patients, which is ultimately why I think all of us got into this business in the first place.
I think so. And I know there's a lot of people who really care about their community, who care about their organizations, who care about patients. The one thing we all have in common is we are all patients. So right. There's also just a self-interest as well, to make sure that we're doing this as well as we can.
Yes, and if we aren't a patient this year, then maybe our mom or our dad or our son or daughter or somebody we love has been. So we're all affected by this, and whether we know it or not, we're all in it together. So I agree with you. I think we should all be able to come together, and you talked about this at the summit in Virginia. And it always sounds so much easier than it is. But I think that's where the relationships, that's where the listening, that's where it all comes together. And when we partner, it works. Yeah,
agreed. Well, speaking of some of the different audiences that we are thinking about, a huge one is physicians. We've been talking about healthcare organizations and AAPPR's members, but I know, and we've had conversations, that you have two different audiences that you're more, dare I say, more equally serving, because you need physicians who want to work in locums and want to do it again, and stay in locums. How do you balance the needs of those two groups? What's on your mind when it comes to supporting physicians?
Well, that's a great question. And when I got here, I'm coming up on 4 years at Jackson&Coker. When I got here, we changed our mission statement, and we wanted to simplify it at J&C. And our mission statement is to connect providers, and we use the term providers to talk about physicians and advanced practitioners. So to connect providers and communities to transform lives. So that's what we're trying to do. And it is a unique situation, because we have two sets of customers. Our customers are our clients. We call the hospitals, healthcare organizations, our clients. And then the providers are the physicians and advanced practitioners. And really what we're trying to do is connect them so that we can transform lives in communities all over the country. So that's exciting. And that's a mission statement. A lot of people have asked me, Jackson&Coker has grown significantly over the last few years. They've seen a difference in how we do business. Hopefully they've seen a positive difference on how we do business. And I think the biggest thing is that we have a group of people who are energized around that mission. And again, it's common sense, but sometimes in our world, common sense is uncommon. And we're trying to do that in a way that resonates with both sets of our customers, which is the clients and the healthcare organizations, but also the providers, because there aren't enough physicians, as we all know, but the physicians are leaving the workforce in numbers that have never been seen.
Right.
And it's not just because they're retiring. I mean, there's a lot of frustrations around the administrative burden that they're being asked to do. I mean, for the most part, physicians went to med school to make a difference and see patients, and now they're doing a lot more than just seeing patients, and they're being asked to do more and more. Cultures of organizations where they work, that matters. You may think, well, they're physicians, they're just seeing patients. Well, the culture, the leadership of the organizations that they work for, that matters. And there's just a lot going on. The well-being of physicians in this country is at an all-time low. So we're trying to help solve that. And the good news is, 20 years ago, I'm told, I wasn't in locums 20 years ago, but I'm told the stigma that we're trying to overcome is that physicians did locums because they couldn't get a full-time job somewhere else.
Right. And that still sort of lingers today. I mean, it has changed, but that is so powerful.
It's changing a lot, because now we're talking to physicians who are themselves in their full-time role, they're chair of departments, and they're doing locums on the side to see those patients that they went to med school to do, instead of doing all the administrative burden that they have. I mean, we're seeing a whole different level of physician doing locums right now, and a lot more physicians who are wanting to do locums, because we say it around here all the time. If you're a physician and you're doing locums and you're burned out or your well-being isn't good, you're not doing locums right.
Yeah. And that goes for anybody in any career, right? When you're burned out, changing the job is not always going to fix the problem. Like, you've got to heal from being exhausted or stressed out or burdened. And I also see, I don't know if you see this too, but even just when you're in a toxic culture, sometimes you don't always realize it right away.
That's right.
I think people tolerate quite a bit. And if your compensation feels good or fair, you might even be willing to tolerate even more, just for the sake of keeping it easy. Job changing is challenging. It's difficult, right? It's on the top 10 list of the most stressful things you can do in your life. But being in a toxic environment, you learn a lot of bad habits. That isn't necessarily a question about locums. That's just a sort of a leadership staffing question of, when you bring people on and you have to help them unravel, because I love your mission. It actually really aligns with AAPPRs in terms of, we want access to care for everyone. And that's our new vision statement that we just worked on as well. And it's very empowering, but that really wasn't a question. I'm just going to leave that as a comment if you want to comment back.
Well, that's why I always love talking to you, because I think sometimes I think we overcomplicate things. I mean, I think culture matters to everybody, whether it's the organization you lead or the organization I lead. We're not physicians, but everyone wants to go to work somewhere where they're appreciated, where they're surrounded by people who make them better human beings, not just good at whatever the role is they're doing. They want to be thanked and recognized, and they don't want to be a cog in the system. They want to be a part of doing something that's making a difference in the world. So when you have that type of environment, it doesn't matter if you're a physician in South Dakota or you're living in Annapolis and leading an organization, or it doesn't matter. I think everybody's looking for a lot of the same things, to your point.
Yeah, yeah, they are at all levels, whether it's the C-suite, it's physicians, it's those on the front line, your paramedics. I know, there's oftentimes, times of year when we're a little bit more attentive to sharing gratitude. A lot of pressure, like, oh, this is the time I need to send my thank yous. I need to do these kinds of things, but it's really important to do it all the time. I was just reading another article of, take every opportunity you can to just to see people. It's not like a thank you for this and thank you for that, but remembering someone's name is hugely honoring. I think a lot of things that we can do as leaders and as colleagues to see and thank one another.
Well, and I think it's important to do, to your point, all the time, not just when you want something. And I think we live in a world where a lot of times when people are taking the time to handwrite a note and say thank you, I appreciate you, or they're calling or whatever, it's almost, we live in a world where it's almost, okay, what do they want?
Yeah.
We have to overcome that. And I think the only way you overcome that is by expressing gratitude and appreciation for people when you don't want anything.
Yes. Yeah, I agree. Well, hopefully, all of everyone who's listening today, whether they're working at a locums agency or somewhere in the field or at a healthcare organization, I hope that they, also just extend a thank you to someone. And speaking of which, thank you, Tim. Thank you for having this conversation. I thought that just seems like a natural place to say thank you with no strings attached. I always appreciate these conversations.
I do too. I always enjoy talking to you, Carey, and I appreciate what you do and what your members do. And, as you and I have talked about, how can we increase the partnerships between your members and what we do? I think that the physician recruiters around the country that are members of your organization would be amazed at how similar their job is to the physician recruiters that we have here at Jackson&Coker.
Mm-hmm.
And I think that the underlying mission that most people that succeed in those roles is they're trying to make a positive difference in the world. And I think we have to continue talking about things like this so that they can come together and work together to touch those communities like we were talking about and transform lives. That's really what we're trying to do.
Well said, Tim.
Thanks for having me.
Thank you. Have a good one.
You too.